Dr. Sean Tierney here. I'm going to talk about the first CMC joint, basilar joint arthritis. Some people will say it's a saddle joint between your carpals and your metacarpal that allows this motion of the thumb that I'm kind of moving around here. So that's one of the most mobile joints and one of the most dexterous joints, and I think is what makes our hands so dexterous, so very important in our life. You don't know it until you have a problem with it. So it's not uncommon to get arthritis in this area. I would say it's the most common joint in the hand or wrist that gets arthritis. And it can be severely uncomfortable. A lot of times it gets to the point where it just looks like there's pieces in that joint. The nice thing about it is, even when the arthritis is severe, we tend to have good results with regenerative medicine in healing that joint. I don't think that there's a good surgical solution to that joint that keeps your mobility in your hand. So I think we have one of the better solutions right now. The issue with the joint is it's surrounded by nerves. So there's a recurrent branch of the median nerve that can be irritated by that joint. There's a deep branch of the ulnar nerve that can be irritated by that joint. Sometimes the pain is on the back, and the superficial radial nerve can be irritated by that joint. So you have all this series of nerves, and a very arthritic inflamed joint potentially can happen. And it's good that the sooner you start treating that joint, the better, because the better results we're going to have. What we tend to do is we tend to use a hydrodissection procedure where we inject fluid to push the nerve away from the inflamed connective tissue, which is very effective to increase the ability of the nerve to get circulation and take the pressure off the nerve so the nerve functions better, not as in pain. And then, and probably long-term, most importantly, is to put a regenerative solution into that joint that's effective. We have one that is, and gets that joint to become less inflamed, less arthritic, and less symptomatic for you. Now, once you have severe arthritis in that joint, is it going to look like a normal joint again? Probably not. It's more of one of those things that you want to prevent it from getting worse and get it better to the point where it's gradually getting better in time rather than gradually getting worse. Typically what we'll see is we'll have to treat that 1 to 3 times the first year, once a year for a few years, and then every other year, and less treatment is required as time goes on. What we tend to do is inject the joint, hydrodissect the surrounding nerves, and then we usually have you wear, it's usually a good idea to wear a brace just to take a soft brace, just to take the stress off of that joint as it's healing. Now, as we treat that joint, you are healing a structural problem. So I usually don't predictably see improvement in the joint itself or pain from the joint itself before 10 to 12 weeks. So if you get that injection, sometimes the regenerative solution and the hydrodissection will relieve a lot of pain. If it doesn't, you don't have much pain relief in the first week or two, probably the relief is going to happen between 10 and 12 weeks. So don't be surprised that relief takes some time to get there, but it does happen. It's a very predictable thing. And then if you're still uncomfortable with where we are, or if we need to do more, we'll do more at that 3-month point. It's always that 3-month point is a good time to retreat. If you have to get it better faster, and money is not an issue, sometimes we'll do it more often, but the general rule is let's treat that again in about 3 months. That's that first CMC joint, that saddle joint, that basilar joint, arthritis, usually at the base of the thumb, causing pain here or here, and quite uncomfortable.